All right, Ben, in this video, I want to give you 3 self-mobilization techniques, and I'll show those to you right now and then explain a little bit of the reason why I see them work. Also, I didn't want to do a lot of redundancy. I'm sure you've seen like the Kelly Starrett Supple Leopard book featured in Tools of Titans or 4-Hour Body with Tim Ferriss. So I'll leave those out. You can obviously always go back and reference them. I think you even interviewed them at one point. But anyhow, I'll show you my go-to self-mobilization techniques. I use these on myself. And I think if I'm correct, you're right-sided SI joint pain and hamstring tightness. So it makes a lot of sense. And I know you know exactly how that works with your background, kinesiology, biology, etc. And training background, hamstring attaches to ischial tuberosity. So what we want to do is rotate that. So if you're on the right side, what you're going to do is lay on your back, grab the right knee, push down, 5-second hold. You're going to do that 3 times. This is just an isometric. A lot of people will try to do like a stretch this way. You're pushing your knee down into your hand. Great. So you're getting hip extension and you're using your posterior musculature, posterior pelvic musculature, or the hip extensors. You can do it on both sides. The most important thing is to come back and just give yourself a little squeeze. What that does is resets the pubic symphysis, the joint in the front. So you have right SI, left SI, pubic symphysis in the front, 3 joints within the pelvis. So you just want to come back, give a little adductor squeeze, and usually you'll feel a click literally within your groin. So that's number 1. A little more advanced version of that is you're going to push down on one knee and pull up at the same time. But again, it's an isometric, so what I do here is just alternate 5 seconds one way. Great. 5 seconds the other. 3 times on each side. Again, always come back, do that adductor isometric, and you should click out if you're truly doing a self-adjustment. You won't click out every time, but you'll usually, the loudest cavitation, the loudest click will be on the first one. And the final one's a little bit trickier. I'm going to show you on the left side just because that's the side that's closest to the camera. But what you're going to do is turn your foot out or internally rotate your hip. So kind of hard to see, but you're going to angle your foot out at least to like 5 o'clock if you were looking down at a clock. And then what you're going to do is put your hand on the outside of your knee and push out. And again, just 5-second hold 3 times. And this is for an in-flare, out-flare of the pelvis. There's some controversy on this. I've actually seen it work really well in the clinic across literally thousands of patients. So that's why I've included it here. But you're going to angle your foot out, push out, 5-second hold 3 times. And then the next one is almost like what a lot of people will refer to as a piriformis stretch. You're going to externally rotate your hip or bring your foot in, which would be like to maybe 7 o'clock or 8 o'clock on that clock dial, of 6 o'clock straight down. So you're going to angle your foot in and then bring your knee up towards your opposite shoulder. So your left knee would go to your right shoulder and then just resist with your hand. Same thing there, 5-second hold 3 times. Great. And then as always, you come back, do the adductor squeeze, and reset every time. Now let's talk about really quick why it works. So if you're looking at the pelvis from the front, you have the right innominate, right half of the pelvis, left innominate, or left half of the pelvis, and then in the back you have your sacrum, your tailbone. So 3 bones, 3 different joints, right SI, left SI, pubic symphysis in the front. For most people, at least when I learned about the pelvis, they knew that statistically 70% of the time there was a right anterior innominate. So that means the right half of the pelvis is rotated forward. What you're doing, like when you do that isometric or any of the in-flare, out-flare mobs, is getting that to move normally again, move back the way that it's supposed to, and then you always want to come back. You're getting that right innominate to move. You always want to come back and reset that pubic symphysis, which is the joint in the front. So hope that helps you out. If you have any other questions, you know how to reach out to me or just leave a comment below.